Doctor, are you living the dream or just dreaming of living? It is my honor to announce the PDA 20th Anniversary Special Conference this September 12th to the 14th in Frisco, Texas, the nation's leading course on dental practice growth. If you feel isolated as a leader who is frustrated that your schedule is unproductive, maybe your team is disjointed, or your systems are inefficient, this is the conference for you. The PDA 20th Anniversary Conference has all new features, including keynote speaker Emmitt Smith, who is a Pro Football Hall of Fame running back and entrepreneur. You can choose your own educational track to customize your learning experience. And when you register before July 1st, you will receive a 90-minute free meeting session that can help you boost and increase your productivity before you even attend the conference. Go to www.productivedentist.com and click the pop-up, or select Productive Dentist Academy Conference under the Dental CE and Events tab. That's www.productivedentist.com. Seating is limited. Register today, and we look forward to helping you make your dreams become reality.
As a dentist that's on Weight Watchers, go and get every bit of CE you want to get early on in your career, if possible. If not, go now.
Hello, everyone. This is Dr. Bruce B. Baird, and you're listening to the Productive Dentist Podcast. In this podcast, I will give you everything that I've learned over the last 40 years in dentistry, working with thousands of dentists. I'll tell you, it's not that my way is the only way. It's just one that has worked extremely well for me, and I'd love to share that with you, so you too can enjoy the choices and lifestyle that productivity allows. More time for things you love, increased pay, better team relationships, and lowered stress. Let's get into it with this week's episode of the Productive Dentist Podcast.
Hi, this is Dr. Bruce Baird with the Productive Dentist Podcast. Today's podcast, I wanted to talk a little bit about Weight Watchers. I don't know how many of you guys, have ever done Weight Watchers, but Weight Watchers is for losers. And I got this information from my partner, Victoria, who I heard her speaking to somebody about this, and it just really hit home. And I need to lose a little, but not in the field of dentistry. What am I talking about? Well, Weight Watchers. Let's wait and watch. Why do dentists do that? You get in on you do your examination and you say, Ms. Johnson, you have a broken tooth here and we need to do a crown on it. You have a few others that are kind of breaking down also, but I really think we could wait and watch those. Or they just go through and just tell people pretty much everything in their mouth needs to be, just watch. Let's keep an eye on it. In Texas, that's what we do. So why is that? I mean, I started asking questions and talking to some individuals. I was at Paul Goodman's Dental Nacho event, and lots of young dentists there. And that topic actually came up. And I was thinking to myself, why do people wait? Why do they watch things? And I can only come up with just a few reasons. One reason is they don't know how to do the procedure, or they're not comfortable doing the procedure. As a young dentist, especially post-pandemic, I mean, some of the students, they didn't get to do a lot of dentistry. They did a lot of stuff at home, and there was lots of testing at home, and things were done on Zoom meeting. Well, obviously that's a concern, but they're not all that comfortable doing a crown. So, which sounds crazy, but it is true. There are people out there that it might take them an hour and a half to cut a crown prep. And I always kind of joke with people. It says I can cut a tooth off at the gum line in about 20 seconds. So why does it take so long to cut that crown prep? Well, it's just a lack of confidence and a lack of experience. And so there are people out there that are really doing some great education and teaching. I know Lincoln Harris, he's an Australian buddy that was actually lecturing this weekend. They have an entire program to help dentists get better at their treatment planning. So I think if you really think about it, that is one reason, is just not confident. Another reason, which is more cynical, in my opinion, is they only tell the patient they need one thing done and not the rest of it, is because insurance isn't going to cover it. We've talked about this before. 95% of all crowns done in the USA are done one at a time. And why is that? Well, because you tell the patient they need 3 crowns or 4 crowns or 4 giant fillings or 4 whatever, and the patient has the response, what will my insurance cover? Well, your team comes in and says, well, your insurance is going to cover $1,500, which is a standard statement because most insurance companies cover $1,500. If you have one that covers more, great. Of course, you guys know I hate insurance companies because they have no interest in whether you're successful or whether the patient gets any dentistry done or not. They're only interested in profits. And the PPOs are even worse because they're many times not even directly attached to a insurance company. It's just basically offering discounts to patients and the patients are paying them. But, so what happens to you is after you hear these patients saying, what will my insurance cover? And you say, or your team says it's going to be $3,300 and your portion will be $1,800. Insurance is going to cover $1,500. What does the patient say? Well, they say, can we just do one? And most teams have heard this over and over and over again for however long they've been in dentistry, because this has been going on for a long time. And what it does subliminally, I think it conditions dentists to say, let's watch this. Well, I'm going to use an analogy. What if you went to your heart doctor and, and is dentistry, does that equate to the heart? Well, we know that there are things that happen in the mouth that do can increase risk of heart attack, stroke, all of these things, whether it be periodontal, whether it be infections in the bone, all of these things can affect the rest of the body. But you went to your heart surgeon and he said, I really think we can fix this LAD, which is the Widowmaker. Let's put a stent in that, but let's keep a watch on these other 2. They're only blocked at 40%. Now, would that make sense to you? Would that make sense? Would you want your doc doing that? No. I mean, when people come to see you as your healthcare provider, as a healthcare provider, what are we told to do in our ADA code of ethics? It's a comprehensive evaluation of the needs of the patient. It's not the needs of the insurance company, because the insurance company needs you to only do 1 crown. Why? Because then that's all they have to pay. They get to keep the rest of the money and their profits go up. So why is it that Weight Watchers becomes a big symptom in dentistry? Because it's because insurance won't cover it. Another reason that people wait and watch, number one was they don't really have the skill set to sell it. I've seen that happen oftentimes with big crown and bridge cases or anything like that, where they've just gone to LVI or Pankey or Spear or Coyce, and they come home, they have the skill, but they don't necessarily have the confidence. Skill without confidence also causes people to wait and watch. Confidence without skill causes people to wait and watch. So really, it's a matter of building this confidence and skill together so that you don't end up on Weight Watchers. Because what happens when you're on Weight Watchers in the dental industry is you slim down your profits. You slim down what your production per hour is because of those reasons. So one reason was, don't have the skill. The other reason is insurance, And another reason when you think about it is they just don't have the verbal skills to get a patient to understand that they actually need this work done. And so, when you don't have confidence, when you're always having patients say no, that again starts to build this subliminal message to the dentist and to your team that says it's okay just to do one at a time. It's okay to do a little bit here and a little bit there. And what you can be very confident about, you may not be confident about some of the things you're doing, but what you can be very confident is you're not really doing the patients any favors, because their dentistry is going to get more expensive every single year you watch and wait. Now, so if you think about this, it's not something you really want to be doing. Why not learn? You don't have to have 100 new patients a month or 200 new patients a month to be profitable. You do if you're doing one crown at a time. And that's where you see all of these people. I don't know how many messages. I've deleted at least 3 messages this morning, emails or LinkedIn, that people have called me or sent me messages to say, would you like to have more patients? And, they don't have any understanding of dentistry. They just know that they can use social media and can get patients to come into your office. 50% of those don't show up. And the rest that do really don't need any dentistry. It's kind of a ploy that tries to get people in. And I don't want people that don't need dentistry anyway. So if I look at this situation, I don't need tons of new patients. I just need to do a comprehensive exam on every new patient that comes in. And that's the philosophy of Productive Dentist Academy. Do we do a comprehensive, full-blown exam on a teenager? No, that's a different animal. We have kids that come home from college. If they're 22, 24, 25, they can come get their teeth cleaned unless they have an immediate need. But we market more towards what I've always told you guys. We market more towards the train wreck. Why do we want train wrecks? Because they need a lot of dentistry, and I can help them, and you can help them. So one of the things I said from the stage this weekend was, as a young dentist, or as an old dentist that's on Weight Watchers, it doesn't matter how old you are. There's a lot of dentists that are on Weight Watchers, and so as a dentist that's on Weight Watchers, go and get every bit of CE you want to get early on in your career, if possible. If not, go now. Learn comprehensive skills. Learn how to do comprehensive dentistry. Now, if you're a drill and fill guy that just likes to do one filling at a time or one crown at a time, then don't do that. But I really don't want to go to your office. I don't want to come to you as an expert in the mouth and dentistry if all you're going to do is do whatever makes you feel good. I want you to tell me what the real deal is. And how do I do that? That's where the communication skills come in. That's where asking permission. That's where having a set protocol for how do I do my comprehensive exam. And when you do that, what you're going to find is that not only are you going to produce more dentistry, not only are you going to collect more for your business, but you're actually going to be a win-win. You're going to take care of more people. It's nothing sadder in dentistry than a dentist who has all the skills and no verbal skills. They have all the clinical skills, but no verbal skills to be able to actually get a patient to say yes. Now, is everybody going to say yes? No. And that's, and those are the things that really bother me about Weight Watchers, and I want you to know that there are other reasons too. There are other things that can be done. We've talked about compassionate finance. We've talked about financing, finding ways for people to be able to say yes to all their treatment. That falls within, yes, some financing, but it also falls within the verbal skills to allow people to utilize that financing. So I don't know. I hope you guys enjoyed today's podcast. It's something that really bugs me because I always ask doctors when I go get my elbow checked or my shoulder checked, I tell them, what would you do if it was you? Now, I don't think you'd do it if it was you. I don't think you would just say one crown at a time in your own mouth if you had a lot of work that needed to be done. If you're like me, I want to have all my work done with a couple of pills and sound asleep and get it done today, all of it. And so that's what I want to leave you with today. Tell your friends about Productive Dentist Podcast. We were voted number 3 podcast in dentistry this year. And so I'm pretty excited about that. Thank you guys for spreading the word. I'm not the usual podcaster, which, invites, hundreds of people on the show. We've had people on before, but I just feel like I've got so much stuff up here in my head that I want to get out. When that ends, I'll probably start inviting guests. So anyway, have a great week. I look forward to next week's podcast.
Thank you for joining me for this episode of the Productive Dentist Podcast. If you found this episode helpful, make sure you subscribe. Pass it along to a friend. Give us a like on iTunes and Spotify, or drop me an email at podcast@productivedentist.com. Don't forget to check out other podcasts from the Productive Dentist Academy at productivedentistpodcast.com. Join me again next week for another episode of the Productive Dentist Podcast.